Okay, this video covers about the otitis media with effusion. If you have seen the previous videos, we have discussed classification of otitis media. So otitis media can be classified based on suppurative otitis media and non-suppurative otitis media. In suppurative, we have acute and chronic ASOM and CSOM. In CSOM, mainly two types, tubotympanic and artichoantral. And in non-suppurative otitis media, there are different types like otitis media with effusion, adhesive otitis media, tympanosclerosis, and otitic barotrauma. We'll discuss everything one by one. First, we'll discuss about the otitis media with effusion. So, otitis media with effusion will come under non-suppurative otitis media. Means there is no suppuration, there is no bacterial involvement. So, what are the other names for otitis media with effusion are secretory otitis media. It is also called as glue ear because in children what happens is whenever otitis media with effusion is present, in the middle ear cavity there is thick mucinous tenuous fluid, so it appears like a glue, so it is called as glue ear, and also called as serous otitis media and seromucinous otitis media. So these many names are there. Coming to the definition, accumulation of non-inflammatory exudate. You should remember it is a non-inflammatory exudate. Okay, the fluid does not contain any inflammatory cells in the middle ear cavity. So there will be changes in the mucous membrane in the middle ear, so it will cause the middle ear cavity to have the, it will mainly pour the liquid or content into the middle ear, the mucosa. Okay, so coming to the etiology, firstly there is tubal occlusion. How tubal occlusion occurs is in children, whenever they are prone to in children we can see allergies or enlarged adenoids or inflammation, infections to nose and throat. What happens is there will be tubal occlusion. So whenever there is tubal occlusion, it produces a negative pressure in the middle ear cavity. Why it is producing a negative pressure in the middle ear cavity? Because there is absorption of air from the middle ear. So in a closed content, closed middle ear, there is absorption of air in the middle ear, so it causes the negative pressure which will drive and tympanic membrane gets retracted. Okay, so and also this negative pressure will cause sterile effusion. You know what is effusion? Because of negative pressure from the blood vessels, there is effusion of, here the pressure it is pulling out from the blood vessel. The fluid is pulled out by the negative pressure. So there are two types of contents in the middle ear. Either thick tenuous mucus, it is called as glue ear, which mainly occurs in the children, or there may be thin serous liquid. Okay, so this is about the etiology, and more two etiologies are there. Like in case of allergy, there is mucosal edema and eustachian tube gets occluded, and again negative pressure develops, so effusion occurs. And also next, hypoecgamma globulinemia. It is an inflammatory response, and again due to inflammation, eustachian tube will block. Okay, and again effusion. So next, coming to the pathogenesis, these are the symptoms and these are the signs. So symptoms, what we can see mainly it is asymptomatic. There are no symptoms, and whenever there is negative pressure, we can see sense some type of blocking sensation in the ear, and there will be deafness. Why there is deafness? It is conductive type of deafness due to the liquid in the middle ear. So and why child performance is poor? In some children we can see who are sitting back at the schools or colleges, what happens is they can't hear properly because of the deafness, so their performance is poor, and there is a woolly feeling in the ear, it seems. I don't know what is that. And autophony means whatever we talk, it will be loud for ourselves, and there may be associated with nasal discharge and nasal obstruction. These are the symptoms. Coming to the signs, we can see tympanic membrane is dull and lusterless initially. Then what happens? Due to negative pressure, there will be retraction of tympanic membrane. After some time, what happens is there is effusion. So fluid level is seen through the tympanic membrane, so air bubbles can be seen. See, this is the air bubbles. It can be seen through the tympanic membrane. And also one more diagram. See, in adenoid enlargement, what happens is eustachian tube gets occluded, so there is projection of negative pressure in the middle ear. Okay, so yeah, we are in science. So retraction of tympanic membrane we can see, and after that fluid accumulates and air bubbles can be seen. And whenever there is accumulation of fluid, what happens is mobility of tympanic membrane obviously decreases. Okay, next we have tuning fork test. So we know due to fluid, negative Raynaud's test, that is conductive deafness is decreased, and Weber's is lateralized to the deafer ear, that is affected ear. Okay, absolute bone conduction is normal because bone conduction is not affected, it is normal.